need somebody. Help understanding body. You know I need someone. Help!
Maybe you thought you'd never need anybody's help in any way, but now you do. Maybe you've been an order member for 40 days or 40 years, and maybe you're 81 or 21, you live in Nagpur or Norwich. Let's say you've worked for the order and you haven't been able to save for your retirement. And now you can't pay your fuel bill and you can't go to a retreat centre that you helped to develop. Or you can't afford to buy dentures to help you eat and the NHS ones just don't fit. Or you've been ill, you've had to leave your profession and you want to support yourself, you need to totally retrain your job. Or you're dying and you need some practical support to find a hospice. Or you simply need one decent pair of shoes to go and see your grandchildren and not feel ashamed. So these are all real examples of the support that Abhay Ratna Trust has given to order members with limited savings. And there's a surprising number of us. What I'm saying is limited. We count £10,000 or less as in hardship, basically. Used to be 6,000, but with cost of living. So less than £10,000 or euros, I should say. Maybe you're here today because the Abhay Ratna Trust Convention Bursary got you here, and some people in this room have contributed to that. The Abhay Ratna Trust only supports individuals rather than projects or centres, just so that you understand that. And we're only financially supported by individuals, mostly order members, not by any other charity. So I'm especially grateful to Future Dharma for letting us come up here today. It's a bit of a different kind of project, this. You mostly won't get to hear about what we do because, I mean, who wants to go around, people publicising that you're hard up, strapped for cash? So it's quite private what we do. But I do have someone here, absolutely delightful order member, to say a little bit to you of how how Abhay Ratna has helped her. Please welcome Vishwantra.
Sisters and brothers in the order, I stand here today because I've received help from the Abhay Ratna Trust that has changed my life. In December 2021, the Trust ran an appeal for me that raised £6,000. The Trust has used some of that money to help me recover financially from an episode of bipolar disorder last autumn, during which I was unable to work. The rest of that money is being held in trust for me, should I become unable to work for a period again due to mental illness. Just having that safety net, as well as the help already afforded me to pay necessary expenses, has changed my life. I am so grateful to the order who has given so generously to me. I am deeply grateful for this opportunity to thank you in person today. Here is a quote from Rumi. You have no idea how hard I've looked for a gift to offer you. Everything I came up with was like taking spices to the Orient. It's no good giving my heart and my soul because you have these already. So I've brought you a mirror. Look at yourself and remember me. So this mirror of Rumi's I offer you as a mirror of your generosity. Generosity which can change the tenor of a life from severe stress and anxiety to gratitude and relief.
Some of you will know Silvana Vera, our Russian order member, and he was going to be up here today as well. But I'm very pleased to tell you that in a couple of hours' time, he'll be on a train to Moscow. He got stranded here when Russia invaded Ukraine, and his bank account in the UK and in Russia was frozen. He had no money for 6 months or so. So we raised money for him, and he would have been here to say something about that, but I'm very glad that he's on his way to Moscow instead. So there's a particular reason I'm standing here today. Many of us are struggling or starting to struggle to get support we need for our health. Maybe it's because of a national health service that's faltering a little bit or limited, or maybe, obviously, there's order members living where there's no national health services at all. As we age, I know we don't like to talk about that too much, but as we age, more of us need help with our health. So Abhiratna Trust is launching right here, right now, an Order International Health Fund, which will support order members anywhere in the world who've got limited finances, but they have an urgent or chronic health need. For example, you need a heart operation and you live in a country that will only pay 50% of that. Or an accident leaves you unable to walk for several months. You live somewhere where there's no sick pay. Or you live here or in Ireland, you need a course of physical therapy. Your back's in agony and there's nothing that anyone else can do, and you need to go and see someone like an osteopath. Or you need to pay for counselling following a bereavement. And there's a waiting list for subsidised counselling, but it's 6 months long. These two are real examples of past Abhiratna Trust support. But our budget needs to be so much bigger. There's going to be such a greater need for helping people with their health now and in the very near future. I think it's vital to reduce our health hardship and our suffering as a result of that. I don't think it can wait. It's really important that we as an order look after each other in this way. So I'm here to ask all of us, every single one of us in this room, to care about each other by contributing a little bit of money each month, rather like an order national health insurance scheme, to put into this order health fund, so that when one of us needs it, there's a fund available to draw on. I really feel that together we can do this, and we can start it today. If everyone in this room gives a little something and says, like, I'm in, let's take care of each other. We will relieve physical and mental suffering among us. I'm asking all of you here to please tick the Abhiratna Trust box on your pledge cards when you get to see these beautiful cards. To invest in this fund between £5 and £25 or euros a month. Ideally, that would be 1 to 2% of your monthly income. If you give something, then that fund will be launched into being today. We'll have raised about £25,000 if every one of you can give a little something. That's half our target of £50,000 to really get this going. It will support you or an order member anywhere in the world with an urgent or chronic health need when that arises. This also actually supports our collective Dharma practice tremendously. When you've got a health hardship or any kind of financial hardship, actually, it really does affect your ability to practice. The anxiety and stress, such as Vishwantra talked about, is quite something if you haven't experienced that. One of the most moving grant experiences for me last year was during the initial COVID outbreak in India. I received a request on my mobile phone to help someone be admitted into hospital who's having difficulty breathing. The hospital would only admit her if she paid in advance, and we got the money to her in 24 minutes. I was so glad to get the pictures on my mobile phone soon afterwards of her in a hospital bed, and I'm really glad to say that she's recovered pretty well. So please, when it comes to that, have a look at your pledge card, connect with the reality of the need for us to look after each other, look out for each other by sharing a little bit of your money as an expression of that care. contribute to the Abhiratna Order International Health Fund so that we can collectively and effectively resource ourselves for the health issues that are rising among us now and increasingly as we age. And be confident that if you need this fund one day, because you never know, you could call on it. And in the meantime, it will be available for those in health hardship today, so that we all get by with a little help from our friends, from you, dear friends. Thank you very much.
Help from my friends. Gonna try with a little help from my friends.